to Diary of an Empath. I'm super excited because my guest today, we've been trying to navigate this episode and we finally got it going. And I have always had an interest when it comes to trauma and the brain. So my next guest is Dr. Jen Wolkin. She is a neuropsychologist, speaker, and a mental health advocate. And she's the author of the book, Quick Calm. Dr. Wolkin, thank you so much for joining us. We finally did it. I'm so excited to have this conversation with you.
Me too. Thank you so much. Call me Jen, of course, throughout the whole thing. And thank you for having me, right? There are no timelines. There's only, when things happen. And I'm glad we made this work.
That's right. There's always reasons why things happen. So I have always had a big fascination with the brain and with trauma. And I know that's something that you specialize in, but I want to know a little bit about you and your background. And I always like to just get an idea of where my guests came from and how they got to where they're at now. So tell me a little bit about yourself.
Yeah. No, I appreciate it. I'm a trained health and neuropsychologist. So basically, I'm trained to understand the relationship between the physical brain and our behaviors. And I'm also interested in how biological, psychological, and social factors interact with and affect our overall wellness. So, outside of my clinical practice, I advocate towards ending mental health stigma. And I guess this all feels like a call to action and a purpose that's greater than myself. And being in the collective with other extraordinary humans like yourself, I find very humbling and fulfilling. I'm definitely a therapist who is training outside of a textbook. I have my own lived experience with mental health challenges. I was treated for panic disorder when I was 15. I struggled through depressive episodes in my 20s and 30s. And I definitely have a particular call to action with regards to ending stigma around chronic illness. And, I can get into it or not, but basically it took me 20 years to get a diagnosis of endometriosis and finally the surgery I needed. And on top of that, some other, comorbid or co-occurring, illnesses or challenges. And a few years ago, I actually experienced premature ovarian dysfunction. So basically perimenopause, menopause, super early. And that threw me into chronic migraine, which literally threw my life upside down and impacted my overall functioning. And, that too is really stigmatized. So it's not easy living with the threat of living with so much discomfort, and mental health, of course, is inevitably affected. And I guess, through this, I began to learn more about trauma and the impact that chronic health challenges have. And I just wanted to do a deeper dive into what trauma means and to, understand trauma as something that's not only what society thinks it is, right? A car accident or war, not to minimize those at all. That there are so many things that trauma can be. And I guess, right, because, the intro, I definitely want to be a human here too and talk about, my interests. So I'll just say I'm a writer, actually getting my MFA in poetry. I don't know if you knew that. We could talk about it another time, but I'm a low-key folk music aficionado and I played the guitar. But all this really to say that the creative arts, and I think most importantly, the power of different mediums of expression are important to me, both professionally and personally. And like you said, I recently published my first book. Thank you for mentioning it. And I hope to publish my second book on the psychology of chronic pain sometime. So thank you for having me. I know that was long-winded, but I really just wanted to contextualize things for everyone.
I love that. We have a lot in common. And so just like you, I have endometriosis. I also have lupus. So it's, for those that don't know, that's it's a chronic autoimmune disease. And I have a lot of ovarian stuff and I have a lot of hormone issues too. I've been on hormone therapy for like 6 years. And just like you, are you really? Yeah, it's so funny. Yeah. We're going to have to talk more about this after, because even for me, when I was younger in my teens, I had a lot of trauma. I was diagnosed with panic disorder, and then going into the military, I had other stuff. So it's interesting because the connection with trauma and autoimmune diseases, I feel like there's a big link. And I actually wanted to talk about trauma and stress, but I'm very curious as what is the connection with autoimmune and trauma? How does that show up in the body? Because I
Yeah.
feel like there's this huge connection with the nervous system and autoimmune. And there is some
Yeah.
studies that are showing it, but I feel like we don't have enough of that.
Yeah, and I don't, I won't do a deep dive here because I'm still getting to know the literature, but just to say that is a burgeoning literature to show that, autoimmune disease and chronic health issues, chronic illness also generally has a great impact on mind, body, brain, and is often comorbid with post-traumatic stress disorder. And, this might be due to many, many reasons. You know, autoimmune disorders cause inflammation. It also is a stressor to the body. Stress causes inflammation. There's a lot of research that inflammation plays a role in mental health challenges. Um, you know, pain experienced by veterans specifically, I know in general PTSD, but veterans, and I know your military background, is actually reported as significantly worse than the pain of the public at large
Mm.
because of increased exposure to injury and psychological stress during combat. So that's not necessarily to say that autoimmune is associated, which, there is a burgeoning research. It's just to say that it's very comorbid. And the rates of chronic pain in veteran women are actually even higher. So I guess why is this? But, pain itself can be a reminder of a combat related injury. And, that's not an explanation for the autoimmune. So I know I'm talking around that a little bit, but just giving some context in terms of PTSD and how it's so comorbid with chronic pain and chronic illness. And actually, because of that, that can elicit some of the PTSD symptoms. And then I guess, psychological vulnerability, right? Lack of control is common in both chronic pain, especially autoimmune, where you have no control over your own body, fighting against itself. So
Hmm.
basically, all that to say, chronic pain, including autoimmune, and those who experience trauma, I think what characterizes both of those is that people often feel helpless in coping with the perceived unpredictability, right,
Hmm.
of the physical and psychological sensations that arise in that.
Hmm.
And, you know, yeah,
So when we're talking about trauma, and a lot of people have a hard time distinguishing what is trauma and what is stress because I think that we can trauma is subjective, right? Trauma is going to be different for everybody. There's no one size fits all for trauma. But what is the difference between something that might be traumatic for someone versus something that's
yeah,
stressful for somebody, especially when it comes to how our
yeah.
brain is processing things and how we perceive it?
I think that's such a great question. It's such an on point question because we do live in a society where we use the term trauma loosely. And, I'm very supportive of someone who believes that they've experienced trauma in validating that. And I also think, right, as psychologists, as neuropsychologists, it's important to just sort of talk about it in a more precise way for greater understanding, more precise, right, diagnosis, and most importantly, treatment. And I guess there's so much I can say here, but I'll just start with this and then we can rant, and I'd love to hear your thoughts too. But I would say stress is something that we all face, right? It comes in many forms. It differs across contexts. It could be work related. It could be financial related. It could be social related. It could be in response to a new life change, etc. So some stressors are minor or short term, and others might be chronic. Trauma is actually a specific type of stress, which I don't know if many people realize, right? So trauma is called more technically traumatic stress. So it's an actual type of stress that reflects an exposure to an event, right? Egregious, heinous event that's generally outside the range of just a daily human experience. And I think the reason that it's important to distinguish that is because traumatic stress is the stress that can lead to post-traumatic stress disorder. That's not to say that chronic stress isn't something to heed and to deal with, because actually, ironically, so many of the neural correlates of chronic stress, repeated stress over time, are consistent with a brain which has experienced trauma, right? So I find that like mind-blowing. So basically, trauma always causes stress. Stress on its own doesn't always lead to trauma. And I feel like that's an important thing to discern. They often go hand in hand. But like I said, chronic stress can and does often exist without being traumatic. And I guess to get a little bit more poetic, one of the main differences that I believe separates chronic stress and trauma, and actually wrote about this on Instagram or one of the platforms, is that I think trauma shatters the fundamental beliefs that we've felt to be true about ourselves and our world, right? So like it's trauma and not stress that crumbles our assumption that people are good or the world is safe or I am safe. And yeah, those are my thoughts. I'll always have some more to say, but I'd love to hear what your thoughts in response to that. And I'm happy to rant more.
I think that's
I can
spot
get
on.
really passionate. So
No, that's great. I think that's really spot
Yeah.
on. I love the analogy because that's very true, especially when it comes to trauma, even let's say PTSD. It really shifts the way that we view the world and how we feel in it. Viewing the world as this is no longer a safe place, even though you may now be in a safe environment, a safe place. The nervous system and the brain is pretty much saying like, no, you're not. And that fight or flight system is kind of still on. And it's not knowing how to turn that off versus when you're stressed, you kind of know you're stressed. You can maybe do things to de-stress. You can kind of get back to that baseline. So I love that analogy. Now, let's talk about maybe trauma and the brain. So, what is actually happening when we're exposed to a traumatic event? So, let's just say we are having a traumatic event, something happens. What is happening inside the brain? What's happening to us? And how does that manifest?
Yeah. So what happens when we're exposed to a traumatic event? A lot. But I guess one of the ways I want to tackle this is to first talk about neuroplasticity.
Yes, I love neuroplasticity.
Right? And and neuroplasticity, yes, I love it. It's one of the most empowering concepts. I talk about it all the time. I think it's so hopeful. Basically, neuroplasticity is the understanding that our brain is malleable. Right? We once thought many, many years ago that the brain cards we were dealt with are the brain cards that, you know, we were stuck with. And we're learning more and more that that's not actually true, right? New experiences can actually impact our neural circuitry. And I remember that I first learned this from one of my favorite books, and it's worth mentioning, right? Because I always want to give credit where credit is due. I don't know if you've read it, Norman Deutsch, and he wrote The Brain That Changes Itself. And that just changed my life. And the understanding that our brain is malleable and that we can be our own best neural architects is very profound and empowering. Here's the thing, though, and why I started with neuroplasticity. I'm going to take a drink of water. Is that okay?
Of course.
Most of us view the notion of neuroplasticity through rose-colored glasses, right? So, wow, neuroplasticity, new learning, new experiences can impact and change our brain. And yes, that's true. However, neuroplasticity affords the brain an opportunity to heal from injury, and it also can negatively change someone's neuroprofile. That means that neuroplasticity goes any which way. So even a traumatic event can impact our brain. Even trauma will impact our wiring. And I guess that the way to start off talking about trauma and the brain is to talk about three brain structures. And of course, there are more, but just to keep it like, just a little bit more simple and digestible. When we speak about trauma and the brain, we speak about the amygdala, we speak about the hippocampus, and the prefrontal cortex. And the amygdala is a structure in the brain's limbic system, right? It's actually known as the emotional seat of the brain. Well, basically, the limbic system is the emotional seat of the brain. The amygdala is the fear center of the brain. And right, that helps us determine whether or not a threat is approaching. And if one is, it sends out a danger signal, right? Like an alarm, right? And that it sets off the cascade of hormones, et cetera, that we need in order for the fight or flight response to be initiated. And the thing about the amygdala is that it also helps us indicate when the threat is gone. When one has experienced trauma, the amygdala remains hyper alert to even non-threatening stimuli. And what happens is, and you totally hit the nail on the head and mentioned this before, is that our fight or flight response is continuously activated despite being safe. And especially with PTSD, which is again post-traumatic stress disorder, the amygdala can get really caught up in a highly alert and activated loop where it looks and scans for threats everywhere, which is why I also sometimes say that, those who've experienced trauma have a hard time. Well, I can go so many directions with this, excuse my brain, have a hard time differentiating between a butterfly and like a wasp. What I was going to say, right, why I paused, is that it also has a hard time understanding calm, because even in calm, it looks for threats, right? And that, I guess, the butterfly and the wasp was just a metaphor to understand that it's hard for a trauma survivor, someone who's experienced trauma, someone who's experiencing post-traumatic stress disorder, to sit in calm, because they're always on high alert. And that's where we get the concept of hypervigilance. That's one of the criteria to be met to be diagnosed technically with a post-traumatic stress disorder. So here's what happens is, and tell me,
Yeah, I'm
should I
so
continue
intrigued. Please,
I
please.
get so the hyperactive amygdala is like constantly interacting with the hippocampus, and the hippocampus is the area of the brain that plays a role in memory function. And brain scans have actually found smaller hippocampi, I think that's how you say it, in those with post-traumatic stress disorder. And again, that perhaps reflects the impaired memory experience that's inherent post-traumatically. And usually the hippocampus works to connect and organize different aspects of memory, and responsible for locating the memory of an event in proper time, in proper place, in proper context. And when experiencing PTSD, and I know I've done a lot of interchanging between trauma and PTSD, and we can get to that after, but for the purposes of this, it doesn't matter. When experiencing PTSD, memory becomes fragmented. And this is why, right? People talk about fragmented memory. And this is literally the neural correlate of why that happens, right? So the hippocampus, which becomes smaller, has trouble coherently piecing together memory. And also, which is, I think is profound, it also has trouble discriminating past from present, and then integrating memory of experiences with feelings and factual knowledge. And that's the hippocampus's role in trauma. And this is a really distressing component of post-traumatic stress disorder. Again, if we're being very technical and using the term post-traumatic stress disorder, because this neural correlate, the hippocampus shrinking in response to traumatic event, manifests in the form of intrusive memories and flashbacks. And it becomes a loop because triggering memories then provoke the amygdala, and then that maintains its hyperactivity.
That's right. Yeah, and I have a lot of vets who listen to this podcast too. And I think it's important for those that are listening as well that, you know, when we're talking about PTSD, post traumatic stress disorder, a lot of people automatically think that that's just related to military, that it's just related to combat. But in fact, this is related to anything that's traumatic for the individual. You know, there's no set textbook. Well, we do have a textbook that shows the criteria, but there's no set textbook to say what's traumatic and what's not, right? It's depending on how you go through trauma and how you receive it, correct?
Yeah, you know what? I think this is such an important point. So I'm going to finish talking about the prefrontal cortex. And if it's okay with you, why don't we dive into that, right? Why don't we dive
Go
into
for it.
like
Yeah.
PTSD versus trauma, et cetera? Because I think that's
Yeah,
really
sure.
important. And I already
Absolutely.
can tell that, I love the way you are so validating and holding in your community. And I'm just grateful for all who are listening. So we talked about the amygdala, we talked about the hippocampus, and we talked about the hippocampus and amygdala and the cycle that how they work together to perpetuate this cycle. And there's another area of the brain affected by trauma, and that's the frontal lobe, or specifically the prefrontal cortex. And that's the area of the brain that's involved in emotion regulation, in regulating behaviors, impulses, etc. It's also the part of the brain that's associated with higher order function. It's our human part of the brain, right? The cortex. It's literally what makes us human. It's the part where we get to distinguish between, someone's facial features and what they mean. It's the part that helps us with working memory and executive function. But the neuropsychologist in me is getting lost. Basically, in those with post-traumatic stress disorder or those who've experienced trauma, the prefrontal cortex is notably less active and less able to override the amygdala and the hippocampus. So it's less able to override the signal of the amygdala to tell it, nope, the danger is not real. And it's less able to override the hippocampus as it like flashes fragments of memory. It's not able to say, no, actually, that memory happened then, and we're currently in now, right? Because our limbic part of the brain, or subcortical regions, which not the cortex, right? The relay from our senses to that area is faster than the frontal lobe, because we need to, in a stressful situation, like I'm talking about years and years and years ago when there were saber-toothed tigers, we couldn't think, should I run away from this saber-toothed tiger? I don't know. Yeah, it seems like a good idea. So basically that just gives context as to why the amygdala and hippocampus, it becomes hard to override them at baseline, and then imagine the prefrontal cortex is working less efficiently.
It's like a
And
survival tactic.
yes, and if we don't have that frontal cortex to work with, we're just going to be stuck in past the past and not be able to differentiate it between the present and that fight or flight response. And we're just going to be this like on fire, literally and the amygdala is going to send up this fire alarm when there really isn't one, or there was one and there isn't anymore. And basically, yeah, the neuroplastic brain responds to trauma. And right, so like I said, certain parts of the brain are hyperactive, right, like the amygdala, and others are more deregulated, right, like the prefrontal cortex, the hippocampus, and that just throws off this fine tuning and like exquisite orchestration that I think usually keeps someone safe from real threats. And because of all this, like PTSD is cultivated, right? Because of the post-traumatic neural implications, it's a breeding ground for PTSD and actually other things, anxiety, depression, dissociative disorders, et cetera, et cetera, et cetera. Does that make sense? Any questions on that? Because
Yeah, that's right. No,
yeah,
that's right, because I think too, I love how you tied in even how our ancestors were in a survival mode. It's that fight or flight, right? And that has stayed with us to, really, if you think of like the history of the earth, I mean, us as a human species, we're babies, right? But some of this stuff carries through in our DNA, and it really does transfer down from generation to generation in terms of what we need to do to survive. Because at the end of the day, even though we're in this modern society, our brains still operate as survival mode. We haven't been able to even catch up with technology. But I want to talk about childhood, because I think that too, trauma is something that's very distinct and shapes who we are, from when we're children, especially our environment that we grow up, the way that our parents are, the way that we are taught, that really affects us as adults. So if you are somebody who maybe has dealt with trauma as a child, or if someone has a parent that causes a lot of trauma as a
yeah,
child, how does this present in
yeah.
adulthood? What does this look like?
I guess that's such a loaded question. It's a great question, but such a loaded question because there's no one answer, right? Because everyone has such a unique, like, framework, lens, circuitry, family of origin, right? Specific trauma that's happening. And so it's hard to say, like, oh, what's going to happen if this to this, if this
Hmm.
happens to you or this happens to you. I will say this, right? There is research to say that a child who experiences trauma is more likely, right? It's actually considered an adverse childhood event. Um, you're more at risk for developing mental health challenges because your brain is being wired at its most malleable stage, right? It's most neuroplastic in childhood.
Hmm.
And because of that, whatever you're experiencing, you're literally absorbing it like a sponge. And so if your earliest experiences are traumatic, that is going to impact you. I think there's even a new term, and I don't know much about like the research, but I heard a new term thrown around, and that is neurodevelopmental trauma, just to like sort of name and give an understanding to the fact that this is very real. And adverse childhood events really, you know, impact the brain of a developing child. But again, just, you know, in a very general way, right? It depends. So a person who grows up unable to depend on anyone, right, becomes the adult who is overly dependent, or right, they're the old souls, people say, right, the resilient ones, right, because they had to become these things because they couldn't,
Me.
right, the wise beyond your years ones, right, like
Hmm.
they had to become these things because you couldn't depend on anyone, right? So
Hmm.
for those whose needs didn't matter, right, because there are a lot of kids who just their needs weren't even taken into account. And that, not, by the way, wasn't necessarily manipulative. It might have been because their parents went through trauma and didn't know how to take care of their own needs, no less their progeny. So for those whose needs weren't
That's
met,
right.
right, maybe they grow up feeling not worthy of having needs, right? Or maybe they grow up as an adult who can't make choices, which is why I actually think that being able to give a trauma survivor the ability to make a choice can be really healing and super empowering. But let's say someone was raised in a home where they were held accountable for everyone else's emotions, right? I know this was my mom's experience as the daughter of Holocaust survivors. And she grew up as an adult who feels like she needs to control everyone's mood. Not really control, but she needs to make sure everyone is okay, right? As if everyone's moods are contingent on her and the way she feels.
Mm-hmm.
And yeah, that, I mean, there's so, I can just go on and go on and go, right? Like a kid who had to say yes, right? Or all the time and grin and bear it, or literally tiptoe into a room, becomes an adult who people pleases,
Mm-hmm.
and so on and so forth.
Yeah, I agree.
Yeah, yeah. I mean,
I relate with that. So like for you, your mom, you said, was a
yeah.
Holocaust survivor. My mom was the daughter of two immigrants, both
Mhm.
from, and I've talked about this
Yep.
on my past episodes, but my grandfather's from Palestine and my grandmother is Brazilian. So you have a very Muslim and a very Catholic
Mhm.
divide, right? And so my mom has a lot of trauma from when her mom passed away, and then she had to live with that side of the family. And so she went through her own stuff. And so lots of personality disorder stuff
Yep.
going on my mom's side. And so how that manifested with me
Mhm.
was the control, was the abuse,
Mhm.
was all of these things that where my needs were not met. And I became this teenager who rebelled. I became very sexually
Mhm.
promiscuous because I was trying to get my
Mhm.
needs met with men,
Mhm.
with boys, men older than me. I mean, I had a lot of trauma from my teenage years, and it took me a long time to get through and process a lot of these things. And even as someone now, as an
Mhm.
adult, I'm 36 years old, I'm very self
Mhm.
aware. But how this looks like with me now is I'm a perfectionist. So now I have to constantly go overboard with burnout, and I'm doing a million things, and I almost don't know how to stop because
Mhm.
if I don't do it, I feel like my world is going to
Yeah.
collapse. There's no one there to pick it up. There's no one that's going to be there for me. There's no one that's going to pick up the pieces. It's a survival mode for me. Even though it benefits me, it's provided me the life that I have, but at the expense sometimes of my health. I've talked about I have autoimmune, I've had other health issues, but it's all related to
Mhm.
how I viewed the world and
Yeah.
how I grew up. So I feel like there's a distinct it manifested with how I look at my personality traits, how
Mhm.
maybe even the brain. And that's why I'm so fascinated
Yeah.
with neuroplasticity and the brain's ability to change and be so fluid. So, talking about neuroplasticity, I kind of want to go back.
Yeah.
So, somebody that goes through trauma, so we talk about neuroplasticity that can change the brain in a good way. When someone's trying to heal from trauma, how does that happen? Where does someone start? And what are some of the modalities that they can do
Yeah.
to start to heal?
Yeah. And that's a great question because, right, we do this, right? You and I, first of all, thank you so much for being vulnerable and, for the sake of, you know, people hearing your truth and knowing that it's not something to be ashamed about, and that someone as high functioning as yourself here doing a podcast has lived experience with exactly what we're talking about. And I think these conversations is how stigma goes away. And when stigma goes away, there's
That's right.
more access to treatment. And I truly appreciate that. And there's so much more I want to talk about with you, and we can do a whole nother podcast because I've so
Yeah.
much to say. But yeah, but the purpose of this, of course, is to understand this so that we can eventually heal. So first of all, I want to say that I think healing is very possible. um, I always like to say that we can rewire our brain for wellness, right? And people say, why do you say rewire? Why not wire for wellness? And now we know why. Because So many of us have had this experience where our brains have been already rewired through trauma, and now we want to claim it. We want to reclaim it back. We want our amygdala to soften and, decrease in volume, to get smaller, so that it's not going off like a five fire alarm system. We want to get that hippocampus to be a little bit bigger and more robust, right? So that memories and access to memories and our understanding of ourself isn't fragmented. And we want to get that frontal cortex back online, because we need that to think logically. And we also want the amygdala and the frontal cortex to talk more. So I believe it's possible. And it's hard to quantify. It's not like, oh, now I'm not healed, now I'm healed, which I think why it's so blurred for so many people. And to that, I want to say that it's a process. Healing is a process, right? You don't go from 0 to 100 or 100 to 0, whichever, how you're looking at it. It really is a process that ebbs and flows. It's nonlinear. And over time, we will start to notice it in the way we're showing up for ourselves, for the people around us, the way we react or respond within relationships, and the way we approach our relationships. And it will start to maybe take a back seat. So it won't be in the driver's seat of our lives, and we'll start to notice that. It won't inform our decisions. It won't impair our overall functioning. We'll have a broader, more robust life. It won't be as narrow. Okay, so I guess treatment, of course, depends on so many things, right? Things like the severity and associated comorbidity, right? So, for example, chronic pain, right? Traumatic brain injury, substance use. But, that being said, there are a number of therapeutic techniques that are implicated in treatment for PTSD. And the reason I'm like pausing and kind of looking like this is because, just like the other questions, there are so many ways I can go with this. So
there are.
I know. I'm like, I can give you the modalities and just list them off for you. What I could also say, which I think I'm going to, is that I want to preface all of this by saying that it's best when trauma therapy is done through a trauma-informed lens, right? That no matter what, the utmost importance is placed on creating a safe, non-judgmental space for someone where we don't force them to, forgive their perpetrator or to
That's
recall events, all the events, especially all at once, right? And we just have to make sure to pace it, right? I know there's, people want to heal, quickly. And as clinicians, of course, we want that for you. We would wave magic wands, truly. And if we could, and we can't. However, I think slowly, safely, in a paced manner is most efficient for the long term. And we don't want to re-trigger, right? We want to create that safe space with as little re-triggering as possible. And we want to give you those skills to be able to deal with any triggers and any like ebbs, that happen in the treatment. Because I think sometimes actually the treatment can be more difficult than the trauma itself. And I know that's an
right.
unpopular thing to say. However,
it's very true.
What I mean by that is so many of us have developed coping mechanisms which are used to numb our experience, and also the trauma itself, right? If we think about what happened, right, we shut down. We often don't remember. And it's not until healing do we realize, oh shit, I don't know if I can curse on this podcast.
Oh, yeah, you can.
oh shit, like that was trauma, and ooh, it doesn't feel so good. And so that we start to feel it most profoundly when we start to heal. And I want to say that with the right therapist, with a trauma informed guide, you will navigate that. They will help give you the tools to deal with the discomfort. So that's one spiel. My next is that I believe that we can only heal from trauma through multiple modalities that include top down and bottom up therapies. And what I mean by that is top down therapies are like CBT, cognitive behavioral therapy, which I actually find really useful in some situations as an adjunct to other techniques. What that means is that our frontal lobe, we use our frontal lobe to help us assess, the logic or illogical, nature of our thoughts, and we challenge them. And in order to do that, there needs to be the assumption that our frontal lobes are online. And I literally just told everyone here that when you go through trauma, a post-traumatic response is that our frontals are offline. And so that's not going to work as a first line treatment. It's actually going to feel shaming and uncomfortable because you're not going to be able to do it. And you're going to then, start to feel more uncomfortable with, why am I trying to do something that I can't do? And so I think it's a useful tool. However, first, let's start with bottom up. And what I mean by that is I also mean body up, and I also mean limbic up, right, in terms of the order of the brain. And those modalities, right, help us understand how to dislodge trauma that's stored in our bodies, and how to identify what we're feeling, and how what we're feeling is uncomfortable, and why, and can we stay with it? Can we increase our window of tolerance? Can we stay with a certain emotion, right? Do we know where that emotion exists in our body? And so again, top down and bottom up make a really good combination. And I don't think there's true healing from trauma without both modalities. That being said, there is research for cognitive behavioral therapy and trauma. A lot of people don't like CBT at all. I happen to think it's an extraordinary tool at a certain level of healing when someone's ready for it, so that they can start to challenge the distorted sense of self and the lens through which they're looking at themselves and the world and their future that has been elicited through trauma and being a survivor. Before that, I'll utilize modalities like biofeedback and internal family systems work. And there's something called EMDR, which maybe you've mentioned on here before. And I'm not certified in it specifically, but it can be a very, very healing modality. And then, of course, there's pharmacology. And what I want to say to that is I'm a big proponent of adjunctive psychopharmacological treatment when it's warranted. And what I like to do is, in my practice, is bust stigma around that too, because, sometimes we need medication to help us be able to take the edge off enough to do the work. And the way I like to talk to my clients, my patients, is that we were building the foundation of a house, and we were, hammering nail in nail. We were building the foundation of a house, and we were hammering in nails. We wouldn't use our bare hands. We'd use a hammer, and the hammer's the drug. It's not like the hammer just hammers by itself. We're still holding it. It gives us that extra oomph so that the foundation can be set properly. And so there are many, pharmacological treatments that have helped those who struggle with post-traumatic stress disorder, the symptoms of it. And I always advise coupling that with therapy, because I don't think there's healing with drugs alone. However, if medication is needed, I'm a big proponent of helping someone realize that if they were diagnosed with diabetes, they would take insulin. And this is absolutely no different, right? So like medication for lupus, medication for any autoimmune, heart disease, it is no different than taking a medication for post-traumatic stress disorder. And if you're saying to yourself, but wait, that's a mental health disorder, A, so what? But B, I literally just went through how, just like autoimmune impacts mind, body, brain, so does trauma.
That's such a good point. All of them are just so spot on. There's so much I want to say about this because the brain is just such a powerful part of the body, and people don't realize how powerful it is. And it's interesting too that even in my profession, although as an LCSW, a licensed clinical social worker, we learn so much about environment and so much about mental health and how it affects
Mhm.
people, how their environment affects people. We really don't learn enough about the brain. And I feel like that it's
Mhm.
not studied enough in the mental health profession. Another thing that, you mentioned is that trauma can be stored in the body, and everything is energy. Even trauma is energy, and that energy
Mhm.
can become stagnant in the body. It's such an
Mhm.
important tool to be able to learn mindfulness techniques and to understand. I love how you said that, you're not necessarily a textbook type of therapist, right? Because not everything can be in the textbook. Yes, we have a DSM, which is kind of like our Bible, but not every trauma is one size fits all, and not every modality to treat trauma is going to be one size fits all. So I love how you have these different techniques. And just like you, I think CBT is great, but it's not for everyone. I've had a lot of clients that have come to me in the past when I did CBT and was like, I don't like this. I don't like how I'm
Mhm.
feeling. And then they would stop doing therapy. And, where I was working at the time, I think that you've had some similar experiences working for a structured organization where
Yes.
sometimes, you have to, yeah, you're told, no, this is how you have to treat. And it's like, yeah, this can be good. And there's a lot of studies, but it doesn't work for everyone. Sometimes you have to start in other places. So I love that you kind of look at every
Mhm.
person as something different. I kind of want to switch gears a little bit because I saw a post
Sure.
that you made and you said, stop glorifying the hustle. Let's talk a little bit about burnout. So I'm really curious as what do you mean by let's stop glorifying the hustle? Because for me, I was like, yes, because that is me all the way. So how does burnout affect the brain and what are some of those long-term
Yeah.
effects?
Yeah. I mean, hold on to your seats, everyone, because there is research that the brain on burnout, right, is looks similar to the brain that's been through trauma. I just
Mm.
want everyone to like take that in for a second. The brain on burnout looks similar to the brain on trauma. And I find that mind blowing. And, people are like, well, you're so on your soapbox about, or you're so assertive about stop glorifying the hustle and stop glorifying pushing past our actual bandwidth. And I feel like I'm so vehement about it because burnout is much more than just an emotional response to long hours or a challenging job, right? And it like literally takes a profound toll on our body and our minds and our brains. And so the results suggest that burnout, right, can impact that frontal cortex, that same frontal cortex I just spoke about with regards to trauma. And that's the area essential to cognitive functioning. That starts to thin. Like when they did research, and I can't quote a specific researcher right now, I'll happily get, a citation for you, but there was research that showed that compared to controls, those suffering from burnout had more pronounced thinning of a part of the prefrontal cortex.
Shit, I'm
And
screwed.
no, you're not. Because neuroplasticity.
That's right. That's right. Oh.
You're not screwed. You're not screwed. Right? It just means that I think, it's time to like take a step back. And I don't know. I think I became a neuropsychologist because there's no more convincing understanding for people than when I tell them it impacts the brain. Mm-hmm. So in my book, right, I talk about chronic stress, the brain, and mindfulness, and how that can help the brain. And why I do that is because brain nerd, neuropsych, and also because I can tell someone from here till tomorrow, this will impact your health and this will lower your immunity. And they're like, okay. When I start mentioning brain, it's like a whole new level. But really, right, there's an overactivation in the amygdala in burnout, just like with trauma. And so, yeah, I think neuroimaging is beginning to show that people suffering from burnout, and I actually think it's now a medical diagnosis, burnout, right?
It should be.
I'm wrong. I think it's in the ICD-10. Yeah. So people suffering from that, their brains look similar to those who've experienced like trauma.
I'm not surprised because we live in a very high functioning society where we are taught that you should be working 50, 60 hours a week. You got to hustle. And although I respect the hustle, especially if you're trying to get a business up and running, but you can't do that forever, right? It's not sustainable. Everybody has had their periods where they have to work a little harder. They got to grind a little bit because maybe they're doing a project, maybe they're doing something. But when you have that like these long stretches of just go, that's not sustainable. Yeah. And I'm guilty of it. I know better. I know about neuroplasticity. I know about the brain. I know about mental health. And I still find myself doing these things. So for me, it takes active awareness. And like, I have to actually sit down and plan, even if you got to sit down and plan it out. And that's me. I got to plan out my self-care. I have to plan out like, okay, I am going to stop by 5 p.m. every day. But it takes active work to do that. Yeah.
100%. And here's why I think it's harder for you. Because I think, and I'm not saying anything you didn't say, and I'm clearly not diagnosing you, but you said your overfunctioning is a stress response, right? And so I feel like there are literally like deep rooted reasons why you can't stop. So first and foremost, gentle with self, right? Gentle, right? You come by this so honestly. You're doing this as a way to survive and adapt. And you're realizing, okay, maybe this isn't working for me. Maybe it's not the most efficient, adaptive, and effective tool. So how can I now, reassess?
Yeah, absolutely. And I'm actively working on it. And to everyone listening, you're not alone. I think that a lot of us go through this, and I can literally,
I struggle with
and even therapists, even people who are in the mental health field, we're human. We still go through all these human experiences. But I think just to your point of all these nuggets of wisdom that you've dropped, is there is hope, because the brain it's plastic. It has neuroplasticity. It has this ability to change. And so I could literally talk to you for hours about this. And I'm just so grateful that you came on the show. And I have this tradition when I end the podcast that I like to get insight from everyone because everyone brings such amazing experience. So for you, just looking back at your younger self, what advice would you give to yourself?
Yeah. It's such a hard question, and I'll tell you why. Because the perfectionist in me the recovering perfectionist in me wants to give the perfect, most poetic, most, brilliant answer. And at the end of the day, I'm just like, F it. What I really want to tell my younger self is you are so goddamn lovable.
Mm-hmm.
That's really what it boils down to. And I think is going to be or would have been, right, a buffer for some of the later traumatic experiences, right? So my advice would be a love letter.
Oh.
You are so lovable, even when you doubt it the most.
I love that. And so tell me a little bit about what you're up to now. I know you wrote a book. I want everyone to be able to find you. So where can people find you? What are you doing? Is there any
Yeah.
projects that you're working on?
Thank you so much. I'm at Dr. Jen Wolkin on most all social media outlets. I have a book, quickcalmbook.com, easy meditations to short circuit stress using mindfulness and neuroscience. And I'm working on a course just that's linked up with the book. And I'm working on other courses, online courses, one about sharpening your memory as you age. And I'm hopefully, fingers crossed, diving into a second
Mm.
book as my bandwidth permits about the psychology of chronic pain
Oh,
and
that's
all
awesome.
things, related to that.
Well, I can't wait to,
So thank you for having
yes.
me. You're very
Thank
helpful.
you for coming on. I'm excited to see this next book when it comes out. I love everything that you're doing. I've been following you for a long time. A lot of your posts are just so insightful, and that's one of the reasons why I wanted to have you on the show. I'll link everything for everyone to follow you. And again, thank you for your time and your energy and for coming on.